All right, let's go ahead and formally begin. Welcome, everybody. Thank you so much for joining us this afternoon. My name is Dr. Ashley Greenwald. I'm a research associate professor at the University of Nevada, Reno, and I am a member of the Western Regional Collaborative on School Mental Health. Just to quickly introduce our group, we are a collaborative of three different states in the Western United States, Nevada, California, and Washington State, all coming together with the intention of sharing best practices, learnings, resources, policy advancements around school mental health in the Western region. Today, we are bringing to you a really, really wonderful presentation with experts from the national level on universal mental health screening in schools. So, so grateful that you all are able to join us. We hope that you have some great learnings and outcomes from today. I am going to hand this over to my colleague Luke Anderson from California to describe some logistics, and then we will begin.
All right. Thank you, Ashley, and welcome everybody. I'm just going to talk Zoom real quick here. So you are joining a Zoom webinar. So that means that if you're an attendee, no webcam, and you will be muted. That's just the way that Zoom has these set up. We are going to utilize the Q&A feature today. So if you look at your Zoom toolbar, there'll be a button that says Q&A or questions. And if you type questions into that, our panelists will answer as we see them come in, either by typing a response, which you'll be able to see in the Q&A, but we'll also reserve some for the end for more detailed responses. So again, no webcam, no unmute. I think even the chat is probably disabled, but that Q&A feature is going to be your best way of interacting and getting us questions. With that, I'm going to pass it to my colleague, Stephanie Moore, who's going to kick us off.
Hello, everyone. Thank you so much for being here. We're super excited to see you. And I'll also note that today is National Children's Mental Health Awareness Day. So what a timely occasion to be together talking about universal mental health screening. I want to give just a plug. Thank you for joining us today, and I'll invite you to come back and join us at the same time next week for part 2 of this webinar series. Today, we're going to be focused on sort of building a foundation of our understanding. Next week, we're going to really think about now moving from policy to implementation, and we'll have a panel of some esteemed state and local leaders in the Western region to help us have an informed conversation about how we move this practice forward. But for today, I'm really eager and excited to be here with two of my colleagues who I'll introduce in just a moment to talk about best practices and implementation of universal screening for social, emotional, behavioral, or mental health needs. As I mentioned, I'm here with two of my colleagues, Dr. Katie Eklund from the University of Wisconsin-Madison and Dr. Nate Von der Ems from the University of South Florida. Both are also members and co-directors of the School Mental Health Collaborative. And I'm joining you all from University of California, Riverside. I'm going to get us started today, but you'll hear from Katie and Nate as we go through the presentation today. I also want to give a nod. The three of us are here as part of a larger team who recently released an updated implementation guide focused exactly on what we're talking about today. So the QR code that you see on the screen will take you directly to the link to this implementation guide that you also see here. So this guide was first released back in 2020, I believe, and then we got together with some new folks, myself included, recently and just released this updated version to kind of reflect current context and some new thinking about best practices and implementation. In terms of what we're going to be doing today, I'm going to get us started with an overview of sort of why we're here talking with you all about universal screening and what that might look like in terms of key features. Then Nate's going to talk through some procedural considerations, thinking about essential readiness and data use expectations. And then Katie's going to talk with us about some really important ethical and legal considerations for us to keep in mind as we move toward implementation of this practice. We're hoping by the end of this session that you'll be able to describe the purpose and core features of universal screening, to identify best practices for universal screening as part of a multi-tiered system of support framework, as well as to really be aware of and understand some key legal and ethical considerations when we're implementing universal screening systems. So with that, I'll get us started. To really start by thinking about really what is the impetus or the need for this conversation and the practice of universal screening in today's context. As I imagine most of you in this webinar are familiar, young people's mental health has been a pretty important and growing concern. The World Health Organization has defined the current state of child and adolescent mental health as a public health crisis, and we've heard similar language from our national leaders in the US as well. Approximately 40% of children will experience a significant mental, emotional, or behavioral symptoms, that warrant the need and access to mental health supports throughout their educational career. But at the same time, right, most of those mental health needs in the US remain untreated or poorly treated. And we know that there are disparities in who is identified and who actually receives needed supports. For example, Black students tend to be overrepresented in special education eligibility for emotional disabilities. Meanwhile, Hispanic and Latino youth are actually underrepresented in those categories. Similarly, youth from historically minoritized backgrounds are more likely to be under or underserved when it comes to addressing those mental health needs. And we know, right, these concerns about young people's mental health were really growing in the years prior to the COVID pandemic in 2020. And the pandemic, for many of us and many in sort of the broader community, really shone a light on these needs and the limitations in our larger system capacity in order to be able to actually address those needs. But if we look sort of in the 6 years almost now, right, or I guess a little over 6 years since the pandemic began, these concerns have not really waned. They've largely continued and potentially increased, according to some data, although some trends are indicating that there's been some improvements in recent years in terms of persistent sadness and hopelessness amongst our young people. But overall, there's still a lot of data that indicates that we're still in this type of crisis when it comes to students' mental health needs. And, right, we know that many of these mental health needs are addressed in school contexts, right? Schools are already a primary setting for addressing students' mental health needs. And so what can we do in our schools, right, to better address these unmet needs? It's essential, right, to find new solutions because students who have emotional behavioral concerns, especially that are unmet, are more likely to experience a range of poor school-related and long-term outcomes. These include things like low academic achievement, higher rates of exclusionary discipline, more likely to be absent or be in contact with the juvenile justice system. These students are less likely to graduate high school, and they also have a range of poor sort of psychosocial outcomes as well. Right, so there's a lot of reasons why this is important for us to think about. And many of these reasons sort of underlie the common arguments that we hear about why we should do universal screening, right? And these common arguments include things like, for example, screening provides essential data that can guide our decision making within an MTSS, help us make sure we're doing the right programming for the right people. It also, as a proactive practice, can help us shift toward more proactive and preventative approaches as part of that multi-tiered framework. Universal screening can enhance equity in the identification and access to services for young people while also helping us to streamline and be really intentional about our use of resources. And there's emerging data that suggests that school-based screening actually reduces mental health difficulties amongst youth or has the potential to. This was a recent study out of Australia. So we've been talking a bit, right, about sort of this national framing, but I also want to pause for a moment and highlight just a few initiatives in our Western regional context with the caveat that I know I'm not representing all of the states in our Western region in this overview. But I do want to acknowledge that thinking about at least a few examples from California, Washington, and Nevada, these states have been really intentional in working to build school mental health systems and have been growing in our interest and focus on providing supports around universal screening. And we see this webinar as an opportunity to sort of highlight some of that momentum, as well as to provide some really tangible and practical guidance for folks who are trying to do this practice in your school and district context. And so just to briefly touch on a few of those initiatives, for example, in California, there is a large network of state policies supporting children and youth mental health. One of the most prominent was the Mental Health Services Act, which was recently revised through Proposition 1 to be called the Behavioral Health Services Act. But as part of this proposition-based revision, this act was expanded and also somewhat shifted in terms of the funding priorities and what types of services are able to be funded. As a result, there were some changes to previously funded activities that were accessible to schools that now folks were maybe concerned, maybe that's changed, right, as part of our funding priorities, but also now how are we fitting universal screening into that new framing? At the same time, right, we have the Student Services Act, so the Behavioral Health Student Services Act. And as part of the most recent set of funds, the commission who oversees this funding stream awarded grants to 9 counties to support planning for universal screening implementation. So there's a real motivation and effort in our state to try and build capacity around universal screening and thinking about how it fits within our broader youth service context. I'll make a nod to the Children and Youth Behavioral Health Initiative, multi-year, several billion-dollar investment across many streams to try and build capacity, increase service coverage, and so on. And I'll mention as part of that, right, there has been some funds that schools can use to support systematic screening efforts like universal screening. And then finally, I want to just give a nod to our broader state context. In California, we have very deep geographic, racial, cultural, and political diversity. And that diversity really necessitates the adoption of universal screening systems that are equity centered, affirming, and flexible. Right? So there's a lot happening in our state, but there's a lot happening in other states as well. So Washington has really been, I would say, a policy leader in this realm, thinking about school-based screening and identifying students' needs. You can see here that in 2014, Washington state law required all schools to have a plan for the recognition, screening, and response to emotional or behavioral distress. In 2021, though, the Washington state's auditor found that only 19% of schools that were surveyed were actually screening all of their students. Right. And so as a result of this audit, they recommended that the state model template plan for districts really go beyond a narrow focus on suicide prevention and to more broadly include universal screening. So that was great progress. So in 2022, the Office of the Superintendent of Public Instruction really updated this model template plan to include universal screening. But in 2023, when they did another survey, they found that only 54% were actually using that required district screening, had that required screening district plan. So the legislature wanted to sort of study this and figure out how they can increase the uptake of this policy. And so in 2025, they asked our colleagues with the University of Washington Smart Center to conduct a landscape analysis that was requested by the state, as I mentioned, to really explore what's going on with this policy, what's happening around screening. And they found that there was a lot of buy-in for this practice, but there was also a lack of a shared definition around what is universal screening. There was inconsistent implementation. There were structural barriers in terms of like knowing what tool to select and how do we make this responsive, as well as just confusion around these legal requirements. Right. And so I'll just make a note too. In California, we did a similar study and we found very similar findings. So again, there's lots of interest, but also a lot of confusion and uncertainty sometimes about how to do this work well. And so this webinar is here to help support that. I mentioned some of the funding and policy context in California, in Washington as well. Individual districts, donors, and the Inclusionary Practices Technical Assistance Network are the primary sources of funding for universal screening and training and technical assistance in Washington state. And then finally, shifting over to Nevada, the Nevada Department of Education has been doing a lot of work around multi-tiered systems of support and interconnected systems frameworks. And they funded the University of Nevada, Reno, PBIS Technical Assistance Center to really help expand MTSS statewide, which included some technical assistance on social, emotional, and behavioral universal screening. As a result, right, Nevada has produced statewide universal screening resources, including guidance on billing for Medicaid for those preventative services. We heard a little bit about that with CYBHI in California, and that includes universal screening. Recently, we want to note, right, that 14 of 17 of the Nevada school districts are implementing universal screening, right? So there's a lot of uptake in the state of Nevada, and 3 of those districts are planning to bill Medicaid next school year. In terms of ongoing work and supporting implementation of this work, the University of Nevada, Reno PBIS Technical Assistance Center also collaborates with state partners, including the Nevada Health Authority and the Department of Health and Human Services, to establish a shared state vision and policy for SCP screening. So I recognize this was a whirlwind tour of some of these states, right? But my intentionality here is to really shine a light on a lot of the efforts that are already happening in the Western region to advance universal screening. And as I mentioned, the focus of today's webinar is really to try and create a little bit of synergy and common language around what do we mean about universal screening and how do we do this in alignment with best practices. So with that note, I'll get us started. What is universal screening, right? So what do we mean by this? We heard from Washington and California that there's sometimes some confusion and definitional uncertainty around what this means. So for today's conversation, we're going to use the term SEB, social emotional behavioral health and well-being, which we really see as encompassing social, emotional, behavioral, and mental health. We use this language for a couple of reasons. One is that it's strength-based. It's aligned with an outcomes-driven approach as well. And this type of language is maybe most familiar and sometimes most palatable to educators in school contexts. The way in which we define SEB health and well-being is depicted here. And you can see that it's aligned with really a growing body of research that illustrates that the absence of problems actually doesn't infer well-being, right? And the presence of positive emotional states or happiness. Instead, right, there are environmental and student level factors that are associated with social emotional behavioral concerns, as well as a distinct set of SEB strengths, assets, and competencies, as well as mindfulness traits and mindsets that foster well-being and associated academic benefits. When we think about sort of a complete mental health status, that's really indicated when an individual is experiencing both low levels of SEB concerns and high levels of SEB strengths and competencies. And so if we're thinking about SEB screening, right, our focus could be on these strengths and competencies. It could be on, right, these concerns, but it could also be on both, right? And the focus here is really guided by our main question or the main question of your district or school site, as we'll discuss a little bit later. I also want to point out these boxes at the bottom of the diagram here, which each depict potential environmental and contextual underpinnings of SEB concerns and competencies. These aren't the focus of screening, but rather they are essential factors that we have to consider in interpreting screening results and planning for supports that we provide to students. Now, I want to situate universal screening within a broader context of identifying students' needs. In many school-based contexts, right, current systems for identifying student mental health needs and strengths vary quite widely. The most common methods often include things like teacher referral, for example, to student support teams or student study teams or COST teams, as well as, for example, looking at school-based behavioral records, right, like office discipline referral, suspension, or attendance indicators. And although these methods can help us to identify students, especially students with behavioral needs, they also are frequently criticized for being reactionary and susceptible to bias. For example, when we rely on these methods, children are typically referred for and receive services only once they demonstrate behaviors that are significant enough for school staff to start having challenges maybe with managing classroom behavior. And as such, right, these types of referrals tend to over-identify boys and young people with externalizing presentations while simultaneously under-identifying girls or those with internalizing symptoms. And so these methods, right, have been linked to some of the disproportionalities that we started our conversation with today and potentially contribute to delays in identification. And so universal screening is really posed as an alternative or a supplement, an additive thing, right, in addition to other referral methods we might use in schools. What is it? Well, it's proactive, right? As opposed to reactive. And so universal screening is this systematic and proactive assessment of these early signs of SEB strengths or concerns in all students, right, within a certain educational context. And that educational context could be our whole district, it could be a whole school, but it also could be a whole grade level or a certain classroom, right, if we're just getting started and we want to start small. Importantly, universal screening is conducted to inform as well as evaluate Tier 1 or universal programming, and it's used alongside other data to guide decision-making at Tiers 2 and 3 in our multi-tiered system of support. But universal screening is not a few things, right? Processes for universal screening can vary, right, in terms of its scope or the function, our objectives. But we're not using universal screening to do things like make high stakes decisions. Universal screening is really not intended to assess symptoms for diagnostic or clinical purposes or to identify serious behavioral risk, right? Like trauma, self-harm, violence, or suicide. Screening also, really importantly, it differs from more anonymous surveillance or assessment instruments, things like climate surveys. In California, we have the California Healthy Kids Survey, which do provide helpful information about like our overall population and population level needs. But it doesn't really support decision making for individual students, right? Which is a key function for universal screening. Universal screening also is an essential process within a comprehensive and multi-tiered system of support. You can see here, right, we have a continuum, of course, of SEV supports and services, but we also have a continuum of assessment within those multi-tiered systems of support. And that continuum of assessment includes universal screening, right, which informs decision-making at tier one and potentially, right, guides decision-making for tier two or tier three. But we also have targeted or second gate types of assessments and screening at tier two, as well as more intensive evaluations that are happening at tier three, right? And so screening is just one part of our data collection methods as part of this MTSS. And so with that in mind, I want to just note a few key features of universal screening. I already mentioned this idea that screening has to be implemented as really an essential process within an MTSS. And what I mean by that is not only is it integrated into that system of assessment, but it's also integrated in a way where it's aligned with our district or community's vision for SEV health in general, right? How are we using this information to really assess and evaluate the effectiveness and responsiveness of our system of supports and strengths? How are we using screening data alongside other data that we're collecting as part of that multi-tiered system of support to help inform decision-making across tiers? In addition, universal screening really is meant to build on student, family, and community partnerships, meaning they should clearly understand why we're doing this, and the reasons for which we're doing screening should be grounded in the input of our community members. We're doing it in a way where we're being transparent, and as Katie will talk about later, we're also being thoughtful about how we obtain consent. We're also, right, the focus of today, implementing this in alignment with best practices. So are we adhering to ethical standards? Who is our population? But importantly, right, we're doing this in a way where we're being systematic, we're being timely, and there's a codified process for how we're administering this data and collecting data and making decisions, as Nate will talk with us about later. This work, I want to mention, should be led by a really diverse team, a diversified team that reflects people of varied roles in our community, as well as includes people with expertise in social, emotional, behavioral, and mental health assessment and intervention, right? And then finally, I'll talk a little bit more about this in just a moment. One of the big questions we often hear from folks is, well, how do I choose tools, or what kinds of tools should I use? And really, right, we want you to be using tools that are aligned with your purpose and with how you're going to be using those data, right? And so the tools that you're using for universal screening should be aligned with the reasons you're doing this, right? What types of information are we hoping to learn? And then what measures are we using that can actually give us that information and are aligned with how we're planning to use that data in the future? They should be psychometrically validated, which I'll talk about in a moment as well. But I also want to highlight that these are just characteristics of one point in time for those students, which is why we want to use other data to help make those decisions. And then I would be remiss not to mention that a key feature of universal screening and something that's really aligned with how we've put together this guide is a focus also on doing screening in a way that works towards socially just and equitable outcomes. The best practices that we describe in the guide and that we'll talk through today really complement a socially just and equity-centered approach to doing universal screening, which, for example, focuses on prevention and promotion in a way that decreases potential disparities in mental health services and access. It's also strength-based, so aligned with that more complete model of mental health. And it's aligned with sort of a culturally responsive, inclusive, and accessible way of practice, right? And what that means is, again, we're doing this in a way that's rooted with communities and families. We're being more systems focused, and we're thinking about assessing the health of our environment, right? Are we doing screening in the context of schools and districts that help students to be well, right? And I already talked a bit about implementation as part of an MTSS, but when we're thinking about equity, we're really trying to strengthen and enhance our tier one services and supports. So now that we have this foundation, I want to talk just briefly about that purpose-aligned tools and measures, because as I mentioned, this is commonly a question we receive from folks about how to do universal screening. And so I want to start by just posing some key questions to you. So if you're at a place where you're already screening or you're thinking about screening, these questions still apply, right? Because you can reflect on the tools you're currently using and thinking about, does this meet our needs? If you're not in a place that's screening yet, right, well, these questions can help you think about what tool may be most appropriate for your potential universal screening practice. Importantly, right, when you're choosing a tool amongst the many, many, many possible tools that exist out there, again, it's really essential that you're making these decisions in a way that's aligned with your local context. So yes, we're asking what tools are available, but we're also asking what are our goals and objectives for doing universal screening? And those objectives can be varied and may vary across districts or even across schools in a certain context, right? That objective could be we want to identify population level strengths and concerns, right? We're really focused on tier one. It could be, right, that you're thinking about using that data to inform programming or small intervention groups. So using universal screening data in combination with other data to inform tier two practices. It could be, right, that you're interested in monitoring or evaluating the effectiveness of your tier one practices, or focused perhaps most commonly on identifying students who might need additional support. So any or all of those objectives could be relevant, but you want to think about what are our primary objectives. And then again, what information will we get from this tool and how will that information help us to make those decisions or work toward those objectives? Those are the keys. There's no single best tool for everyone, right? It's really about which tool is best for you and your context. And so when we think about evaluating some of these tools, right, we maybe have a few in mind or that we're considering. There's a few key characteristics that we want to keep in mind when we're comparing those tools. Chief among them is technical adequacy, which includes things like for whom was this measure developed and in what context has it been studied? Most basically, if this is a tool that has been mostly used in secondary school contexts, well, maybe it's not going to be the best tool for second graders, right? And so you're thinking about developmental appropriateness and sort of who was the population this tool was intended to be used with. But you also want to think about psychometric properties. So things like, does this tool have evidence that it's reliable, right? It gives us consistent information, or that it's valid for the reasons we want to use it, right? It's been validated as a universal screening tool, or there's some validity evidence that it can be used for certain types of decisions or in certain contexts. In addition, classification accuracy is a key type of validity that's really important when we're thinking about universal screening, especially because many people do universal screening to identify potential risk and potentially use that to inform connections to higher levels of support. And if that's the case, well, we want to be pretty confident that that tool is identifying the right students. And so classification accuracy is essential data we want to consider as well. But I also want to highlight that a tool has to be usable for us, right? And usable in these contexts. And so these tools need to be brief. They need to be feasible to actually administer and score. They should be cost efficient. But I want to point out that free tools or sort of publicly accessible tools are not always free, right? You want to think about the time that staff may have to spend in terms of scoring data, creating reports, and really interpreting that information. Whereas if you sort of have an at-cost tool, some of those things may be automated. So it's just different types of costs that you have to consider in your context. But usable also means, right, that we're able to use these tools to help us make timely decisions so we can get that information quickly. And it allows us to use the informants that we're looking for. And I'll talk more about informants in just a moment. The last key consideration of these tools that I want to mention is contextual appropriateness, because we can have a tool that's technically adequate and usable, but if it doesn't actually fit with our context or our goals, well, then it's probably not the right tool for us, right? So again, are the constructs that we're measuring appropriate for us? And are those aligned with our interests and goals? And then of course, was this tool designed for school-based screening and with our population of students in mind? Big caveat here, not an endorsement of any tool, but these are just tools that are commonly used in universal screening practices. What you'll see in red next to each of these tools is the type of informant that has forms available for these measures. So the BAS-3 BEST has teacher, parent, and student rating scales. The SSRS-IE is a teacher-completed measure. The SSBD, also a teacher-completed measure. The SABRS has a teacher and student version. The DESA has a teacher version. The Social Emotional Health Survey, the SEHS, has a student version, and the SDQ has both teacher, parent, and student forms. When we think about informants, we want to be strategic, right? You just heard that there are opportunities for teacher, student, and sometimes parent report as well. We should be making decisions about who's completing these screeners in a way that's really aligned with practical considerations, developmental considerations, as well as context-specific considerations. So practical, I want to think through most often it's like most functional to begin with one informant, although we may get the best data when we have multiple informants. But maybe start with one, and then once we've got that going pretty well, add in another informant and then think through how to use those data. When we think about context, for example, teachers are the most common informants, right? They have great knowledge of the academic context and normative behavior. But parents have information about students across context, right? They have more of a whole student perspective. And then students themselves are really good informants and tend to know a little bit better about their own internalizing states. So again, thinking about what they might know. And then developmental level also has an influence, right? So teachers, again, most common across developmental levels. But in elementary, sometimes we rely more on teachers in terms of efficiency, especially for younger kiddos. And then for secondary, self-report is more common. So now that we've been kind of oriented to some of these key considerations and thinking about measures, I'm going to pass it over to my colleague, Dr. Van der Ems, to talk about some procedural considerations. And I'm going to give him control of my screen here, so it should work pretty well. Take it away. Let me mute myself first, sorry, and then I'll give you control.
All right, I think we're working. Thank you so much, Stephanie. And again, really happy and excited to be here with you all today. So today I'm going to be talking a little bit about both the procedural considerations and some data use considerations when you embark on your universal screening journey. So let's first start with some of the overall realities of what an implementation of universal screening looks like in your district or school. And I wanted to highlight 5 primary areas of the broader context for the discussion that follows. I think first and foremost, it takes time. When we're talking about universal screening, I can't tell you how many times we've had some interactions with schools. You're like, hey, yeah, this is super exciting. We want to do this. Can we get started next week? And honestly, there's a whole bunch of work that has to happen before a single screener is given. And so part of that work is getting community buy-in, understanding what parents, teachers, students, and administrators want from this tool and overall process. And this, of course, requires teamwork. So once you have that buy-in, having people at that table, and then developing and co-developing these kind of procedures that are going to best really fit that local community and context. To do this effectively, we always recommend to start small and then scale up. So what does this look like? It could be starting with a certain grade level. It could be a set of schools with 7th graders, for example, and then scaling up throughout that school and then across the district. One of the districts that I'll highlight later in our discussion today, we've been supporting for almost 8 years, going from 2 elementary schools to almost 50. It takes time. Certainly that's a longer version of that, but I'll show some of those examples as we go throughout. And then lastly, it needs to be tailored to the local context and resources. As Stephanie just mentioned, there's no one tool that'll fulfill all of your hopes and dreams. It's really about what is the primary question in which you hope to answer with these data. And different tools will give you different answers to that question. And that data will, of course, then inform different types of services as you move forward. So there's a couple really key strategic implementation decisions that should guide this work moving forward. First and foremost, and I have to say it because it's usually the first question we get when doing these kind of trainings, what screener do you recommend? We don't. It's really not a tool purchase, it's a systems decision. And so when you think about this kind of work, 5 questions should really drive this kind of process. First and foremost, it's the purpose. What problem are we trying to solve? What question are we asking? And that ultimately will help determine what kind of data you're looking for to answer that question. The second is timing. So when in the school year, how often, when will screening occur? Do you screen twice a year? Do you screen 3 times a year? Well, it depends, right? How are you using those data, whether it be for intervention selection, for program evaluation, both? And these are questions that are going to be highly localized. We generally recommend between 6 to 8 weeks into the school year, but that could be flexible depending on when that school year starts, different fall breaks, et cetera. The third big one is communication. So again, before a single screener is given, how are you going to explain that process to families, staff, and students? When it comes to families, depending on your state context, this could be things like parent consent, which Katie will talk about in a little bit. It could be explaining what these data might look like when a parent kind of gets these data back for the first time. As a parent myself, no parent wants to see for the first time a note from school that their kid is quote unquote at risk, Like, what does that mean? How is that going to help my kid? So these kind of things should be really thought through very carefully before any screening is implemented. The next is data use, and I'll have a whole section on this. And that is who sees the data, acts on it, how's the data protected, how are these data fitting within a particular decisional timeline, decision rules, all kinds of fun stuff that we'll get into. And then lastly is response capacity. Oftentimes we hear as a primary barrier to installing screening systems is as soon as we screen, we're going to have so many kids identified, it's just going to completely overwhelm our system. Well, there are certainly valid concerns there, but I also think there are some very real tools that can help you resource map in terms of understanding what capacity you currently have within your building, and then how do you align those services to what you might expect on a universal screening in terms of results. And I highlight, just one state's context here, but it applies to many, in that you're often should be aligning the goals of your screening systems as part of an integrated mental health strategy versus some kind of standalone activity, right? Screening should always be connected to some broader system of care. So in terms of what is universal screening, and to build on what Stephanie had presented, screening doesn't replace any single evaluation or diagnosis or anything like that. It really helps to answer three questions. And that is, at tier 1, is our core supports working? At tier 2, what students might benefit from supplemental or targeted supports? We've worked with a lot of school teams in terms of how they're implementing their tier 2. In your own school building, one question to ask is, well, what are your selection criteria for tier 2? Oftentimes is, well, hey, came back from this conference and I've learned a really new, awesome counseling technique and I want to try it out. Or I've got a group of parents who are really concerned about X, Y, or Z. Screening helps to systematically improve that selection process for tier 2 interventions. And then ultimately using these data as one part of a broader evaluation in terms of what students might benefit from further kinds of evaluations. So I'm going to highlight a few readiness actions for you to consider as we move forward. And so confirming what your tier 1 looks like, what are your tier 2 intervention protocols are in place, and then what is that referral pathway after tier 2 are really important things to do before engaging in some kind of screening. So when it comes to complete SEB health, and again, as Stephanie mentioned, it's really important to identify both student needs as well as student strengths, and not all screening tools do that. So I think it would be our opinion, rather, that screening tools should assess both risks and strengths, and these kind of data will really be critical for helping you build not only tools or interventions that would help reduce psychopathology or symptom reduction, but also include explicit skill building for those students that maybe not disrupted to the classroom environment, but still need that support for their mental health well-being. So let's talk a little bit about some of the implementation realities when you start to go down this process. As I alluded to before, screening systems take multiple years. It's not a single rollout. Of all the districts that our team has supported over a number of years, there's not been a single district that kind of went full district at day 1. Oftentimes it's this phased rollout. And I like to think of this as a year 0 in terms of planning. So before a single screener is given, you have a set amount of time, maybe ideally a year, where you're forming your team, you're defining your purpose, you're doing your due diligence and selecting your tool. As Stephanie said, there's no one tool that's going to meet those needs, and free is never free. And so I think having a chance to understand not only the different costs and evidence of a tool, but what are the implementation realities? And that is like, what are scoring protocols? How are those data aggregated? And how do those data help facilitate decisions are really important in that planning phase. In that actual first year of implementation, oftentimes we recommend a pilot phase, so a subset of schools, grades, et cetera. And this really helps to refine some of the logistical challenges that are highly localized. So for example, one year we had some challenges in working with very specific teacher union rules, for example. Another year we had state legislation change that really dictated how we might implement screening and notification procedures. So these kind of things certainly will change over time. And what I present here is not intended to say that this is a pure linear process, but maybe a stepwise process that oftentimes reverts to prior steps depending on changes in the overall context. Year 2, or the maybe third phase, if you will, of this process is then scaling. And then finally is sustaining. And that is, how are we building these data in terms of continuous improvement cycles, equity audits, risk ratios, those kinds of things for your data use routines. So common pitfalls that we've seen over a number of years in supporting districts is really this rushing to scale. Oftentimes schools will want to go from a pilot phase in year 1 to a scaling in year 2. Many schools might not be ready for that. So the pilot phase might be going from 1 grade level to 2 grade levels, and then a full school in the years that follow. So not training staff is also a big one. And training your staff involves not only training them in the procedures or logistics of filling out for a screener, but also the constructs themselves, right? Do we expect, for example, our teacher raters in one type of universal screening to understand the behaviors that are measured on that screening tool the same? And so if it's a veteran teacher versus a first-year teacher, they might have very different kinds of perceptions around the behaviors they're rating. And then screening as an event, not a process, is also one of the pitfalls that we've seen. So how do you plan for this? And that's really important to plan for staff turnover, and doing so by embedding continuous improvement and training procedures. We often use a train-the-trainer kind of model to make sure that schools are able to sustain these practices over a number of years. Some of the tools that really can help you during this process are some implementation checklists. I'll have an example of that in just a little bit here. So the implementation checklists, I think, are really helpful for kind of gathering these different kinds of processes, procedures in a single place. This can help specify roles and responsibilities. It helps to show what that timeline looks like across the entire year. It helps schools reflect on what is the communication plan? How are we communicating with families, staff, and students? A good implementation plan will also have decision rules for how data will be reviewed and acted upon. The last thing you want when giving a universal screening is to have data analysis paralysis. And so you get a lot of data back, and then what do you do with it? So having those kind of decision rules figured out ahead of time can really help to avoid that. That then leads directly into follow-up and progress monitoring procedures. And finally, things like data privacy, storage, and access to protocols are all really helpful to specify during that phase 0 planning phase when you're doing your implementation checklists. So there's an example of that implementation checklist and planning guide. You just kind of see a screenshot of one portion of that checklist. You're going to find these kind of checklists and other kinds of resources in that free PDF guide that Stephanie referenced at the beginning and will be, I believe, at the end of our presentation as well. So let's now talk about 2 different kinds of roles within the screening process as it relates to implementation. Certainly, this is not a hard and fast delineation, but maybe just kind of buckets of roles as you think about different kinds of procedural considerations moving forward. The first being at the district leadership role, and that is finding a tool that's both grounded in evidence fit, as well as the capacity of the actual district itself. This is where you're going to bring in some expertise as it relates to truly what is the evidence for the tool. We see all the time different kinds of groups or companies wanting to sell their particular tool that just quite frankly don't have the evidence to support its use in different kinds of contexts. And so understanding what is your local context and making sure that the tool grounded in evidence that fits the population in which it's intended for. And there's not that many tools that might fit all those different criteria. In terms of consent versus notification policy, this is really important to have legal review, and legal review both as consistent with district policy, but also state regulations and federal law, as that might guide your different screening decisions. For data systems, oftentimes when we're thinking about data systems, it involves some kind of network storage, whether that is through a local provider as a part of the screening system itself, but how those data are secure, especially when it comes to student privacy of those records, is going to be really important, as well as how those data are either connected or not to a broader system of data, whether it be your school-wide information system or something like that. With regards to staffing and funding, it's oftentimes, but not always, oftentimes the district leadership role to allocate staff and funding that allows for that funding, that allows for those follow-up supports. And then the last 2 considerations for the district leadership role is installing crisis response protocols as well as equity monitoring. In terms of the next role, in terms of the school team responsibilities involve a few things. And that's, again, kind of very local, and you're going to see some variability across your district. So focusing in on the individual school, and that is, what is the right window in terms of your instructional time? For example, are you going to administer the universal screening during third period across all grade levels? Or is it just one grade level team that's doing the screening? So those kind of individual decisions have to be made at the school level, as well as that communication plan with parents. School teams are often the ones responsible for training their educators when they're doing a teacher completed the universal screening tool. And they also are the best ones suited to convene a data review team, coordinating follow-up supports, and then any kind of implementation issues that arise, and certainly they will arise, being able to communicate with a district leadership team that might be able to not only clarify guidance, but then install consistent types of supports across multiple schools where these implementation issues might arise. And so as a readiness action, school teams should really focus on screening systems rather that include that explicit link both between district policy and school practice. So the communication coordination between the district policy teams and the district leadership teams and then the school implementation teams are really critical for that success moving forward. So a little bit more on the capacity concerns that I had raised earlier. Oftentimes, when you're screening for the first time and before your raters might be calibrated with each other, you will have higher than not identification rates. Not always, but many times. And so what does that actually mean? I had a school principal once say, hey, I'm really concerned that we have a really high rate of students identified as need. Does that mean we're not a good PBIS school? And so I think having an understanding of what do those high rates mean, right? It's a signal in terms of how do we think about what level of supports that we can certainly provide. If you're hitting at 30, 40, and even higher rates of students in need, oftentimes schools might not have the capacity at tier 2 address those. And so that would indicate there's a need for some kind of strengthening of tier 1 supports. Something much lower than that, then maybe we focus more on tier 2 capacity, and what kind of capacity that we have either at the classroom or small group level. And or is there a specific event or context that is elevating need throughout the year? And ultimately, this will help us calibrate based on the local needs of that particular population and how those rates might change over time. So one of the readiness actions with regards to capacity, I always recommend to schools teams is to disaggregate these data by grade, school subgroup, to conduct those equity audits, look at your risk ratios, and this will help really inform what kind of tier 1 progress we're making, and is tier 1 progress equitable across these different groups. So what does a fully implemented screening system look like? Certainly, we would like high participation rates, understanding that there will be opt-outs, and if it's an active consent kind of district and or state, that also might look very different. The data should be reliable, calibrated raters, so think about your teacher training in that regard, low missing data, and then defined actions, as in what are we going to do with those data after we receive those. And so how do we think about the readiness for that? There's 3 questions I'd like to ask teams, and that is, can the team describe what's going to happen after screening? If you ask any teacher or educator in that building and you're asking them to screen a particular classroom, can you also ask them, well, what do you expect after that screening has been completed? Can the team use data to determine some kind of specific follow-up versus a generic one? And then can the team disaggregate those data and follow up for specific student subgroups if they identify disproportionate areas of risk and or need? So now I'm going to talk a little bit about data use expectations, and then I'll hand it over to Katie in just a few slides. So when it comes to data use, screening data are just one point and certainly not indicative of an automatic referral. As we know, within any MTSS system, the intensity and type of the need should always drive the intensity and type of support that follows. So whether we look at screening data as a large portion initially, and that should indicate some kind of support at tier 1. If it's coming to tier 2, we always would prefer these low intensity supports, including classroom adjustments, before getting into something much more intensive. So how do we do that? In step 1, we're reviewing screening data alongside, and I can't emphasize that enough, alongside academic attendance and behavior data. And then what is ultimately the least intensive yet evidence-based support to address that specific need? With regards to database decision rules, and I'll have a few examples that follow, these decision rules can really help a team decide what to do next. So decision rule should include, how scores are interpreted. So any defensible universal screening tool should give you a cut point, a risk level, or some kind of categorization that follows once you get that data back. And making sure that that data or cut point is validated for the population of its intended use. Additional data should also be described in terms of how are we going to use these data. Is there a rule, for example, for a certain amount of attendance or school missed? Is grades going to be factored as one of your risk indicators, as well as discipline and other kinds of input? Who is responsible then for looking at these data and following up, leading those data review teams, and at what point? Within any screening window, we generally recommend that those data teams convene at no longer than 1 and maybe 2 weeks after the screening has been completed. And so that gets directly to the timeline. You don't want a teacher, for example, to complete a screening tool on 25 of their students and then not hear back in terms of some kind of service delivery for a month or two afterwards. And the decision rules can also help with documentation requirements, logging those kinds of actions that follow, and help with retrospective equity audits. So when you're thinking about your data use checks, without decision rules, this can lead to inconsistency, inequities, and ultimately burns the team out when they're unsure of the decisions that they make. So here's one example, and I'm sorry if the graphic's a little bit small there. But step one in this example is that the MTSS team is reviewing attendance grades, discipline reports. You can see there in the graph in terms of what might be considered proficient, at risk, and high risk is defined by this team here. And step two of the decision rules for this example is that if an elevated screen and no other indicators, then it's a classroom-based check-in. If there's an elevated screen plus one additional indicator, then it's a small group. If it's an elevated screen plus multiple indicators, then there's some kind of additional assessment and or safety planning for that particular student. And then followed by step three, where the MTSS then team reviews these progress data after 8 weeks and then adjusts the following support. So this is a really great example from a data use check that no single score will drive the interventions and supports that follow a screening system. Another example is identification for check-in, check-out. As a rule in that youth are identified by low elevation on a screener, has 2 or more office discipline referrals, 10% out of class time, etc. Whereas progress monitoring, what are we progress monitoring on? And that's daily progress report data is collected, reviewed every other week. And then what are the exit criteria as well for those students that receive services after a universal screening? So in this example, youth receiving a total of 80% of their DPR points averaged per day for 4 weeks. So these are all kinds of highly localized decisions that a team makes that are so critical for the actual screening system to be successful over the long haul. So part of that success is going to be directly related to connecting students to that least intensive, most effective supports, as I had mentioned earlier. How do we do this from a data use piece? Is one, starting with tier 2 intervention as the primary starting point. And tier 2 can mean different things to different schools. So for example, is classroom supports tier 2 or small group supports tier 2? My answer to that is yes, right? So how your team is conceptualizing that, again, is something that's more resource driven than a strict categorization. Tier 1 should then be reviewed with as many students as possible who screen at risk. And then ultimately, progress monitoring should drive the change intensifying or fading of those kinds of supports with clear exit criteria into some additional level of support. So just a few more pieces on how data are used, and I'm going to show an example again of a readiness checklist in addition to an implementation checklist. So some key questions about how data are used. So for example, who has access to that student level data? Is it just your data use teams or your MTSS teams, or someone else? How do those data be used to identify and evaluate program effectiveness? What are the limits of data use? And that's often a missed piece when you're talking about data. So what screening data are we not using for discipline referrals or special ed referrals, for example, is just as important as what we are using those data for. And a data use check is being able to document and share these kinds of answers to these key questions with your different kinds of community members or to facilitate that continued buy-in. So a little bit more about implementation checklists and planning, and I'm going to hand it over to Katie. So a couple of the suggested categories there you can kind of see on the screen, ranging from the purpose and goals defined to how tier 1, tier 2, and tier 3 supports are mapped. But the big picture idea here when you're looking at this idea is that this checklist can serve as a readiness indicator, as well as a extension of the implementation facilitation checklist. And it's important not to say that it's just present or not present, but if there's some level of data that are in place or supports that's in place that can already help the school move forward. So we put another screening readiness checklist there. You can see the QR code. I'll kind of briefly show that there. But again, this will be something that will be as part of the PDF guide that we'll show a little bit later. So some primary takeaways. It's important to have readiness before selecting a tool. So defining your purpose, capacity, decision rules are really important. Decision rules are this really important bridge between data and action. Otherwise, screening might not be helpful to answer the questions that your team is really seeking to answer. Data use must be planned, transparent, and always measured and monitored for equity. And one question that I will put out to the audience as you kind of consider your own implementation work moving forward is thinking about what of these elements might be strongest or are already present in your district. And then with the areas that might not yet be totally there, identifying a plan for moving forward and making sure all of these foundational supports are in place as you move forward with your screening implementation. With that, I will hand it over to my colleague, Dr. Katie Eklund.
Great. Thank you, Nate. I appreciate the very descriptive feedback. We are going to be talking about legal and ethical considerations. Our plan for this portion of the presentation, I'll see if I can get the slides to advance here. There we go. We will be talking about how do we obtain buy-in from educators, students, and caregivers. What does our messaging need to look like? Parental involvement and notification, ethical considerations, as well as equity. So the first thing we want to think about with screening is determining how screening fits into existing sources of data and practices. So I saw some great questions coming into the chat about what if we are in an alternative school. I will start by saying every screener, all screeners are not created equal, right? Every screener is created with a different purpose in mind and has a different outcome. And so it's certainly important to think about what is it that you're screening for and what type of data do you hope to learn about your students that you might not already have in place. We gave a list of some different screening measures that you might consider or might think about. Many of those have been normed and validated for use within schools, and others are measures that were normed and validated measures or created in clinical settings, but research has since been conducted that evaluates their use with school populations or within school settings. So certainly thinking about that. I also think it's important to think about screening and its alignment with things like office discipline referral data, grades, attendance, your formative and summative academic assessment data, and how you're going to use all of that to make good database decisions about kids, right? We talk a lot about collecting high quality data to make high quality decisions. Also important to think about how you talk about screening, right? This might be a way, sometimes when I'm talking to people about my research interests, right? I say similar to how we screen for vision and hearing in schools and for academics, we're also looking at how do we do that for behavior or for mental health considerations within schools. And thinking about what does your language look like in your student handbook and policies around screening for vision and hearing in academics, and is there a way to plug that in for behavior and mental health? Policies that you can lean on in terms of parental consent, opt-out procedures if parents and caregivers don't want to have their children participate, really thinking about what that messaging looks like. Other messaging, we address the behavioral and academic needs of all of our students, and all means all, right? If anybody is having difficulty, we want to make sure that we know about any barriers to learning. And so certainly thinking about screening with that messaging in mind. One story that comes to mind for me is we went and met with a local school district about a potential research project with using a universal screening measure. And when we met with the superintendent, or actually we didn't meet with the superintendent, we met with some other district leaders. But the district leaders shared with us, hey, we have a superintendent who really doesn't see a role for behavior or mental health in our district. They really think the purpose of schools is academics. And so we're interested in screening, but our superintendent is not. And so until this person retires, we probably can't participate in this project. And we were like, no problem, we totally understand. You know, we talked about some other shared interests. The very next day, somebody who was at that meeting called us and said, hey, we found this social emotional learning screener that we would like to talk with you about. Have you heard of the SABERS, the Social, Academic, and Emotional Behavior Risk Screener? And we were like, we have. That was actually the same measure that we were chatting about yesterday. But because we had talked about it in terms of behavior and mental health and not as an SEL screener, right? The perception of that measure and acceptability in the district, perceived acceptability was much different. And so certainly thinking about your messaging, thinking about your community as you work to integrate new procedures and measures is important. So how might we engage families in screening? Certainly thinking about what is the purpose and use of screening and the measures that we're using. So thinking about what we're using them for. We want to share how information is going to, or identify how information is going to be shared back with families. So after we have gathered information, we might have a phone call with a parent to say, you know, we received some information back from your measure, a brief measure that your daughter completed, and it indicated that she's feeling sad and having some difficulties feeling motivated to come to school. We wanted to reach out to see if this is something that you're seeing at home and to figure out if we might be able to find a way to work together to support your child. So we certainly want to think about what that messaging looks like, and as Nate indicated and Stephanie earlier, how we're integrating that with other sources of data and thinking also about system-wide changes. If our screening is using, or not using, but having students complete those measures, we certainly want to engage our students in the reasons why we are going to be using universal screening data, right? So we might say to students, you know, we're asking you to tell you a little bit more about yourself and how you're feeling most days. We want to know if you're experiencing any barriers to learning so we can offer you help and support. We care a lot about you here, and this is a way for us to learn a little bit more about you. And so making sure that students understand those reasons as well. Before we start screening, as Nate indicated, considering connections to resources and services, and then thinking about what is the benefit to children and adolescents and their families for participating in this screening process. We're also, one of the biggest questions that come up when we talk about screening is parental consent, right? Active consent refers to when we need parent signature is required for a child to participate. Usually when we need active consent, we see average participation rates to be about 2/3 of our student population. When we're talking about parental notification, some people will refer to this as opt-out or passive consent, but this is more parental notification procedures. This is when parents and caregivers are informed, and there's usually some type of signature or process only when those individuals might be opting their child out from participation. And in those cases, we see average participation rates are much higher and probably establish more of our desired intent of it being true universal screening. And so thinking about what this might look like in your own district and state is important as you begin to embark on screening. Here in Wisconsin, our Department of Ed, which we call the Department of Public Instruction, put out some guidance a couple years ago around if parent consent is required for behavioral screening. And their feedback and guidance to our state is that in general, no. When you have teachers complete screening measures, they're providing feedback on students in their classroom. They see this as being part of normal school procedures and that this doesn't require parental consent. However, they give, and I apologize, these sites are a little bit text heavy, but this is the exact language that our state uses. The next slide then talks a little bit about what about if you're having students provide information about themselves or students to complete the screening measures. And they talk here about the Protection of Pupil Rights Amendment, or PPRA. They basically state, again, long text-heavy slide here, but it basically says that you can ask students to fill out screening measures, but as long as you don't require them to participate, right? They're given the opportunity to decline participation. They're not incentivized for completing the screener. That passive consent or parental notification may be used rather than active consent. And so they give some guidance about what that documentation might look like, but that is their guidance to our state. Certainly, as you think about this in your own district and own state, screening for general ed purposes often does not require consent. And as we start to collect information specific to a child for more diagnostic purposes or for special education eligibility, certainly in those cases, written consent would be required, and there is recent case law that affirms this distinction. So screening, when it's screening versus evaluation. Notification can often suffice when there's teacher completed screening measures, if you don't have state law that prevents you from doing that, and if you're assessing constructs related to typical school learning, so things like cooperation. If you'll remember back to my earlier statement when I started, right, many of these measures are assessing behaviors that are typical to school-aged youth. And then we do have some screeners out there that look more at mental health functioning or were created and in clinical settings, those might be ones that do require parental consent. So certainly you want to think about what is it that the measure is created to do and what are the types of questions that they're asking. I would caution that anything that is asking about suicidal ideation and behaviors, those may be measures where you want to consult legal counsel in your district, because in many cases I've seen those be measures that districts have actually wanted active parental consent. So, but again, just reminding folks, screening measures themselves are not diagnostic by nature. They don't diagnose if a child has ADHD or conduct disorder. They're usually a red flag indicator that something more is going on for the student and we need to gather some additional information. Again, active consent would be required if student self-report measures would be required, right? Students aren't given the opportunity to opt out, or where there is content assessing psychological problems. You want to look at specific states. So our friends in Florida have some state-specific requirements around active consent. And then certainly in most places, students age 18 and over must be consented as adults. But again, when in doubt, seek legal advice if you're unsure what that might look like in your own district. Okay, so a couple considerations before we open it up for questions. I want to leave some time. I know some questions have come in the Q&A. Certainly, the first ethical consideration is we would encourage you to use valid, fair, and useful screening. Our professional ethical guidelines from the National Association of School Psychologists, APA, I know our social workers and counselors often also have ethical guidance, is that you're using valid and reliable measures that are technically adequate and free from bias, and hopefully they have peer-reviewed evidence from the intended populations of students that are in your schools. We also want to understand the limitations of screening. Again, these are early warning signs. They're kind of, again, that red flag warning indicator. They're not intended to be diagnostic, and they shouldn't be used to predict violence or suicide. We would encourage schools to stay away from using multiple narrowband measures, so things that only assess maybe just internalizing paired with maybe 2 or 3 other narrowband measures, because this can increase false positives in our student populations. And certainly we want to encourage you to think about how we're using screening data in collaboration with other student data that we have available to be making individual student decisions. Third, does screening data add unique value beyond existing data, right? We know that this takes additional time, so think about the time and financial resources that are required to do this well, and evaluate it against existing behavioral data systems that you might have in place in your school district. We wouldn't want anyone on this call to start using universal screening without thinking about what you're going to do with the data afterwards. So hopefully you've heard that as a consistent theme throughout. And then finally, schools do have an ethical obligation to act on data in a way that's timely, meaningful, and defensible. We would encourage schools to review data within 2 to 3 weeks of administration, to develop a timeline for what you plan to do with the data after you collect it, and then to think about both at a systems level, how might we change system level practices based on the data that we've received back on the percentage of students who might be at risk, as well as what individual student data is this giving us in combination with other data we've collected to make individual student decisions. So I will turn this back over to our lovely webinar hosts who will guide us through the next steps.
All right. Thank you, Katie. Thank you, Nate. Thank you, Stephanie. We had some great questions coming in on the chat. We were able to answer some, I think, the quicker ones. So I just want to pull a couple out that we haven't had a chance to answer that maybe just will benefit from some additional context. We got one from Naren around a constraint that he hears from school leaders in getting parents to share insurance information for schools to potentially bill for services. And maybe I'll just provide a little bit of context before we hand it over to Stephanie. Just for folks to keep in mind that a lot of the billing that we do in school systems is insufficient to provide the services that we may need to provide. So billing is one option for recouping some of the costs associated with providing social, emotional, behavioral services. But generally in California, it is not sufficient on its own, nor is it required, but it is very helpful. I think this question was directed to Stephanie, so I'll hand it over to her and just give her a chance to give us her insight on this.
Yeah, absolutely. And I'm happy to sort of start an answer here, but I know I'll also, for our colleagues in Nevada too, I know you've been working with schools around this. So if you have thoughts, happy to have you chime in too. But what I'll say here is I was actually at a conference in the Riverside County Office of Ed on Tuesday, and this was a question that was asked also in a session that I was in about CYBHI and the fee schedule and sort of getting this type of information. And so I want to just note that this should be kind of locally informed in a way, right? Sort of the recommendations that I've heard are you want to share information and you want to be clear about what it means to provide this type of insurance or Medicaid information as part of these processes. We've heard from families that they're concerned about having to pay copays or getting billed for these types of services. And so I think it's really important to upfront provide really clear information about what it means, right? Why are you sharing this insurance information and what are the implications for insurance, which is you won't have any copays. It's not going to affect you. You're not going to get a bill for this, right? But then also to do that in a way where you can reach a lot of parents. So are you having these conversations at enrollment? Are you having this when people are doing paperwork? Are you having conversations at back to school night? Because you want to be able to provide that kind of information, like I said, clearly, transparently upfront. So you're addressing the questions and concerns that parents have.
All right, thank you, Stephanie. I'll pause here for our Washington and Nevada colleagues. Any additional context that you may provide?
Yeah, I would say well, kind of just add what Stephanie said. In a lot of states, the services students receive in schools don't take away. I think that's the guidance from Center on Medicaid and Medicare. In no way would it take away services you receive in the community and should be at no cost. So, I think, yeah, open, if you can produce an FAQ of frequently asked questions around this of like, if possible, we're going to bill for this service. And then really like if you want to build your system that even your providers have no idea who they're billing for, they're all documenting the exact same way, and on the back end it will bill if possible. I think that would be the best case scenario.
All right, thank you, Dana. Kelsey, Ashley, anything else? All right, thank you both. Okay, so I'm just gonna keep us going here. So a lot of good questions around PBIS, MTSS framework. We did get a specific question around working in alternative education settings. So this person noted that their school has adopted a PBIS MTSS framework. And then given that they don't serve a kind of broad random population of students, that their students are generally sent to them because they have presented with some sort of academic or maybe an attendance concern or behavioral concern, how might screening look different in alternative education, knowing that the students may be a little bit different from a traditional, maybe comprehensive campus? So I'll just open up to the panel on that one.
I'm happy to take this. I think a couple things come to mind for me. Certainly, with you could certainly use a universal screening measure to make sure that you're still capturing the mental health needs of all students at school. I find that, yes, often many of the students that you already know about will come up as at risk. And so, but there will be students you may not have known about and who may present different concerns when they do a self-report measure than what you might be aware of. And so I think that data can be useful in programming. I've also seen schools and alternative schools use screening for more targeted purposes. So, for example, if you're worried about exposure to trauma or like trauma-related symptoms, you might consider things like CBITS, Cognitive Behavioral Intervention for Trauma in Schools. They have a whole screening process that looks at exposure to trauma and trauma-related symptoms. And that can be used to really help students who might need a specific, more kind of tier 2 mental health service. But I know a lot of our local school district here in Madison, they do universal screening at 6th grade and 9th grade for all students and use the CBIT screening data to guide other mental health services as well, not just plugging kids into CBITS groups. So that might be a good way to think about more of a targeted type screening that'll give you some different data than maybe what you have on those students to begin with. But certainly others on the call, feel free to jump in too.
I'll just add, as part of some research projects that I was doing with districts and staff working in districts and schools in our state in California, I talked with some school counselors at different alternative schools about sort of, their districts were, right, they were doing universal screening as part of their districts and sort of how they were using the data. And in those contexts, the school counselors were talking a bit like what Katie was just sharing. They're administering the universal screener to all their students, but they're really being very thoughtful about using the data to inform their tier 2 programming. So they're thinking about how are we meeting the specific, right, social, emotional, or mental health needs that are coming up with our students in our school, recognizing that there's a lot of them, but it helps us to think about what intervention groups are we going to run. And so they're using it from more of like a planning kind of space, right? Yes, we want to figure out which students will need those groups, but it's also helping them make decisions about what groups are we running in our school and how are those groups kind of meeting the needs of the students that we're working with.
All right, thank you, Stephanie. Thank you, Katie. So just kind of summarizing a little bit of that. So in that alternative setting, probably have fewer students. Maybe one of the opportunities there is because we have fewer students, we can dive a little bit deeper on our screening instruments, and maybe we can be a little bit more targeted based on general student needs, what we know about those, and also the interventions that we're providing. Thank you for calling that out. Jumping back in, thinking about MTSS, PBIS, we had some nice references to the DCLT, the District Community Leadership Team. So that leadership team that guides a lot of our work, being a good place to house this universal screening work. And then there's a lot of nuance that we discussed earlier around the purpose of a screening. So I just want to kind of hold us in that PBIS and MTSS space. And so if we think about our schools that are often implementing PBIS, they're going to be screening and looking for, of course, which students may benefit from additional support, but then also asking how do we best match those students to that need or that support. So I was thinking about our schools that are on the call that are maybe thinking about those two purposes, right? Again, how do we find students that need additional support? And then how do we gain a little bit of information on how to best match those students to either tier 2 or tier 3 interventions? Holding those things, what might be things we would look for in a screening tool if we come with those purposes? So I'll just open that up to the group here. We can't be stumped on this one. So again, just thinking about, or maybe some that you've seen schools successfully use in out there in the wild, if we will. What tools are being used, or what are they considering when they're thinking about not just identifying youth that may need additional support, but how to take a little bit of that information to help kind of select what intervention might be appropriate.
Luke, this is Ashley. I can take a shot at this one. My response to this would be really any of the screeners you could do that with. It's not one particular screener that would be better in any scenario than another if you're trying to identify population-wide needs. Based on the needs of your community and the screener that your school or district have the capacity to roll out and implement, and the acceptance of the families and the school board and all of that on what it is that they're willing to administer. Those data can really be used to identify universal needs, right? So, there's lots of different screeners that ask lots of different questions, but if you're asking about relationships, maybe if, 80% of the kids are responding that they, need or are struggling with friendships, right? Like you just don't know what their response rate is going to be. So you take a look to see, what a large percent of the population that you're screening have identical needs on, and that can help to inform, right? That can either help to inform universal strategies if it's a very large percent of respondents, or, if you've got a smaller percentage, maybe 20% of students are all saying the same thing on a particular question, and they are identified as having a need, maybe that's something that could be considered for a tier 2 intervention. And I think, one of the things that I think about when we're leveraging PBIS or MTSS teams is really the importance of having clinical providers on the tier 1 team so that they can review those universal screening data with the team and help to inform the school team about what some maybe appropriate strategies, supports, interventions could be useful based on how the student body is responding overall. So taking some of that clinical expertise and bumping it down to the prevention level can be actually quite insightful when you are talking about using those universal screening data to inform prevention practices.
Right.
I would offer maybe a somewhat similar, but maybe at times contradictory take when you think about like this link between screening and intervention. It's often been my experience that those screening tools that are most tightly embedded or aligned with a particular curriculum are those that aren't validated for broader use. And so just in the development process, many tools are developed from an evidence base that would make them agnostic to a particular curriculum or a specific intervention, because they're designed to be broadly used across a number of areas. I think the most important thing is like what kind of not only general type of need the tool would be used, but the subscores that could be used for intervention grouping.
All right. Thank you, Nate. Thank you, Ashley. As we're rounding out here, I think we're approaching the end of our time. So I just want to pause and open it up to any final words from our panel here. So any final words before folks go out and start applying some of this learning they got today?
I think I'll just add, and this is maybe in part kind of continuing this thought, but also to Danny's conversation, Danny's question. I do think it's really essential to think about building screening systems alongside MTSS systems. And sometimes, before you're starting to collect data, it's actually really essential to do a resource mapping process or an asset mapping process in your school and community to identify what you actually have. Nate talked about some of those, a couple of examples of how you might look at the interventions or the resources you have in place and sort of set thresholds for how you make decisions about what gets aligned to those interventions, what sort of entry and exit criteria. But you have to know what exists in your context before you do that, right? And so it's really essential, yes, that if you don't have a lot of interventions or ideas about interventions in your school context yet, right? That's probably the starting point. You want to start there by thinking about your service system and what you can offer as part of your service system, and then think about how does your data complement that service system, right? And help you make decisions as part of that. So really, they go in tandem. And so I'm so glad you asked that question, Dane.
All right. With that, I think we're just about at time. I'm just going to drop the, actually, I won't drop them. So the links again are in the chat. There's a QR code there. We are recording, so we will trim the video just to clean up some of the beginning, and we will get it posted and an email out to attendees on where that can be accessed. With that, I think we'll be signing off, and just a big thank you to everybody that was part of our panel and that attended today.